Hello, everybody. Welcome back to the Still I Rise podcast. One of the most common fears that I hear from women in our programs is the fear of cancer coming back. Even after treatment ends, the shadow of what if lingers. It's something that can truly affect daily life. It's how people plan for the future, how they manage their health, or even how they enjoy the present. Today, we're going to talk openly about this fear, often called relapse anxiety. We'll also talk about a very specific form of it, sometimes called Scanxiety, the intense stress that comes with waiting for test results. To help us explore this, I'm so excited to be joined today by Dr. Jimmy Ellis, an oncologist who has walked alongside countless patients through both treatment and survivorship. And he'll be sharing some personal stories, but also how he helps his patients cope. How are you today, Jimmy?
I'm good. Good to see you, Lisa.
So glad that you're here with me. I wanted to give a little bit of a personal thank you before we get started to you. We met in 2016, I believe, and you've been a sponsor ever since. And I think that what is truly unique about that is that a lot of our sponsors, I think, come along. I know they're doing it for the right reason because they truly care about their patients and the welfare of these ladies. But there are also marketing benefits that some of these sponsors get. But in your case, it really is there's no benefit for you from a marketing perspective to
Correct.
Do what you do because you're going to have cancer patients regardless as an oncologist, with or without Unite. What is the reason that you are driven to help with this particular cause?
I think it has a lot to do with the fact that clinicians by themselves can only do so much. We have a very focused approach to taking care of patients and limited amounts of time with patients. There's so much that needs to be done outside of the clinic, and that's where organizations like Unite come in.
Yeah, and I know just from knowing you, first of all, again, thank you. I want to make sure that I emphasize our sincere gratitude for all you do to support our program. Whenever you come to our events, it is so obvious that you have a deep care and admiration for the patients you serve and for even non-patients, people who aren't even your patients. You share that same sort of warmth too. I wanted to share that I know you also kind of lead a very holistic lifestyle with yoga and things like that. So I wonder, does that factor into some of your core beliefs as to how that can help women and men lead better lives?
Yeah, it does. I kind of grew up being involved in sports and running and martial arts and then yoga. And I think that being physically active, being in touch with that physical side of yourself is very important. And we know now from clinical trials that exercise actually has benefits for health and prevention of cancer. I think the mindfulness part of yoga is what helps me a lot.
Yeah, I mean, and imagine that in your position, I wonder, do you ever get numb to what you do because it's just so constant? Or, I mean, do you have to go and de-stress yourself based on what you see?
I do. I mean, sometimes it gets overwhelming. In most days there's a steady stream of stress, and then sometimes it piles up, and yoga is how I start most days, and it actually allows me to go to work feeling very fresh and ready to go.
Good. Before we get started on talking about these very important subjects, I wanted to just let the audience get to know you a little bit better. So are you born and raised New Orleans?
Yeah, I grew up in the old Jefferson part of Greater New Orleans, out by the Long Bridge, and went to Rummel High School and LSU, so I'm kind of a local guy.
Okay. And how did you get into the field of oncology?
So when I was in college, a friend of mine had chronic myelogenous leukemia, and she died from it. And that is now a disease that is almost uniformly controllable for life. And this was before good therapies were there. And I was interested in medicine, and I was really kind of a little bit, befuddled as to how this totally healthy young woman could get leukemia and die in a matter of months. It just made me want to learn more about it, and that drew me to oncology.
Well, that must make you feel so good as a physician to see the progress that's being made with oncology.
Yeah.
Because otherwise we'd quit, right?
Right. It's unbelievable. And I think that's as we talk about survivorship, survivorship is a bigger, broader problem now because so many people are surviving. So it's a good problem.
Oh, wow. Wow. Yeah. Different things you have to tackle as a physician and longer term care probably, or
Right.
more visits, extended visits. Tell me a little bit about what it's like to be in, your office and you are facing somebody who is experiencing this very intense anxiety or just even regular anxiety. I mean, what what is the examples of what you see with patients?
So the initial impact of finding out you have cancer is it's a major traumatic event. It's a crisis, and your existence is threatened, and it can be overwhelming. So we're frequently there at the beginning, and we're with folks throughout their entire experience. So I usually try to listen a lot, explain things in as much detail as possible, and I encourage my patients to talk about their fears and to try to be a good sounding board for that, and to try to help them find other ways to allay those fears as we move into a treatment phase.
Are you aware of the fact that not every physician is that way?
Yeah, we are, and I think there's a lot there. Some of it is that we tend to be a little bit understaffed. We have more to do and less time to do it, and it can be difficult to get all the spend as much time as we like.
Yeah, I mean, I bet you could easily spend an hour with every patient.
We could, and then we just have to be judicious about our time and try to find other ways to get people the help they need.
Yeah, if you have a patient who comes in and you can sense that they are really struggling to the point of needing more than just a nice hug, what kind of do you have something in your toolkit to help?
We have counseling in our clinic. I have a low threshold to get people involved with Unite, where there are a lot of women who have been down that road before, who are wonderful at listening and sharing their experience. So we do have resources available.
Yeah. So you mentioned at the beginning that now that survivorship means, one of the definitions, I guess, is that it's the post-cancer experience, right?
Correct.
And it's living with either the medicine that could be long-term or just, hey, you're doing great, come back in 5 years or whatever
Right.
you say, right?
So, and there's a lot of different scenarios. Some people will always have their cancer, but they'll be living with it as a chronic disease in much the same way people live with high blood pressure or diabetes, whereas previously they may not have survived. So you're living with cancer, which means ongoing treatment and that dark cloud of what if following you around.
Mm-hmm.
And the dark cloud is basically something a patient told me when I was a medical student at MD Anderson. And she said, some days I'm doing really well, but I'll stop and think about it, and the cancer's still there following me around.
Yeah.
And that metaphor has stuck with me.
Right. That's true. It's, it's interesting that you use that analogy because that is truly the analogy I use also when the ladies enter our program. You can feel this dark cloud around them. And then with the sisterhood and the camaraderie with each other in the safe environment, you could see that dark cloud lifting, you know? So like you mentioned earlier, as you said, one of your advice is to have them get in programs like our organization where you can find that, hey, I'm not alone and there's other people who are doing this, and hey, we're here, we're doing okay, we're going to make it together.
Yes.
One of the things that I notice all the time in our program, we have a private Facebook group, and there's probably about 500 ladies from the previous programs. And it is constant. The pray for me. I have, either they've, found a little suspicious lump or something, or it's time to go in for a scan.
Right.
And so they, of course, call it Scanxiety. I know that's probably a non-official medical term.
I think it's a real term now because we've used it so much. But anytime we are approaching a disease assessment point or there's a new problem, it brings right back to that trauma of diagnosis. It brings you right back to the beginning with all those fears. We know this when we order scans, and I try to lead in by talking about the scan as, here are my expectations. Just to let you know this is coming so it doesn't get dropped upon you. And then I'll if I sense something's wrong, I'll ask them to talk about it, because I think if you can talk about it, it's better.
Yeah. We, constantly are hearing ladies who, they had to, one day they were told you have cancer, and then they had to find the strength to fight. They had to just muster up the mental, physical, spiritual side of fighting and really survive some crazy things, right? Whether it be radiation, surgeries, the, loss of hair and eyelashes and body parts and having open wounds and all the stuff that people go through. So then to heal, and then to know that they, like, to have the fear that they would have to go through that again.
Right.
To find the fight a second time is something probably very challenging.
It is. And sometimes, sometimes cancers do come back, and knowing that that's a possibility, in my conversations, I try to let my patients know that if we do find something, there'll be a plan. I'll be with you.
Yeah.
Not alone. Obviously, we don't want to find anything, but we do look a lot. We're very vigilant in our surveillance, and we like to leave no stone unturned. And sometimes our vigilance can create a little bit of fear. So there is a normal amount of scanning and surveillance that's done, and then we respond to new symptoms with something like that.
Yeah. Do you ever have to just point blank look at somebody and deliver discouraging news where the way it's presented, they just say, well, what's the point of fighting? Or is there always somewhat of a path?
Well, I mean, there are times when we know that the path is a very conservative, supportive one. And there are times that the cancer is not going to be controllable. And then we shift our focus to quality of life measures, trying to help people maintain as much autonomy as possible. That's a discouraging turn, but it doesn't mean we give up. We call that a form of palliative care. Mm-hmm. Those are the hardest conversations. It's a lot easier to talk to someone about fighting for a cure than it is to talk about purely supportive measures.
When you have to tell a patient that they have cancer or had a relapse, is it hard on you?
Yeah, I usually take it a little bit hard.
Yeah.
When I know it's coming, I prepare for it.
Yeah.
The good thing about it is by the time I do this, I usually have a well-established relationship, so that it's a little easier than if I was seeing a total stranger in an emergency room and having to give them bad news.
Yeah.
So I think that makes it easier for everyone.
Yes. So what's the most important advice you could give to somebody who is living with cancer, or even, technically declared NED, to be free from that controlling fear of recurrent, or, to not live their life afraid of a relapse?
Well, I think there's always going to be a certain amount of fear that exists. If you find that it's a lot, then I think seeking help with counseling is good. I think support groups and dialogue with your providers is good. And then you're going to, everyone has to kind of find their best way. Faith is a very important vehicle for some people, not as much for others. Having a tribe of supportive people. I think the Unite group is a good example of just a group of women who support one another. And I think they get a lot of confidence from one another.
Yeah. I think definitely the group is important, but I think also a good medical team. So for instance, I just returned from a trip where I was doing SCART with some patients out in Houston. And I'm telling you some of the stories that I hear about, a woman expressing concerns to her physician and just being completely just like, I guess it's called medical gaslighting, right? It's just where their fears are just like not recognized.
Yeah. So I think the worst thing a provider can do is not acknowledge the fear or to diminish that fear in any way. No matter how big the fear appears to me, what's most important is how it appears to you. And to give you an example, if someone has a 99% chance of being cured, statistically, if that 1% is weighing heavy on her mind, it's a meaningful 1%, and we have to address it as such.
Right.
Because each individual faces these things in their own way. We all walk around with certain risks and certain health issues, and we have to find our way And it's important for our providers to recognize our individuality there.
Now, this is probably, I don't think it's necessarily controversial, but I'm just wondering your opinion about this. So the stories that came out of the discussion was that after persistence, they realized they needed to change medical teams. But their team was just not a good fit with them. And they realized, wow, that isn't a universal response. I could be with somebody who is a little bit more, compassionate or understanding.
I mean, I view the provider-patient relationship as a therapeutic partnership. And like all partnerships, some work better than others. And if you're not comfortable with your provider, then you should find another one.
Yeah.
And I think we, as providers, we have to recognize that if I'm not meeting someone's needs, then it's okay with me for them to move on to another person. I mean, I think we all try to meet our patients' needs, but it is a partnership and a relationship, so it's not always going to work.
Yeah, so it's okay to switch.
Absolutely.
Yeah.
And I think I do believe strongly in the value of a second opinion, particularly in something complicated like cancer, where there are new therapies, and sometimes decisions are very nuanced. So as a provider, I welcome my patients getting second opinions. I think it's healthy.
What is your opinion about Dr. Google?
So Dr. Google is dangerous and can be very helpful because there's no context. There's so many different things that can pop up when you Google, and you have to check the credibility of it. So I encourage people to look at websites that are evidence-based, things like NCI.org or major cancer centers that have websites. But anybody can put anything on the internet, and that's a very scary thing in healthcare right now. Right.
So what if a patient came to you and was adamant about a different type of treatment plan than maybe the one that, an evidence-based one that you recommended? What do you do in situations like that?
So it's complicated. It a little bit depends upon if they're doing something that could be harmful to them. And what I have a low threshold for showing people the guidelines I follow and why we follow them. But I do worry about a lot of people getting things off the internet that don't have a scientific basis.
Yeah.
So that there's some art to that.
Right.
And I always tell people at the end of the day, you're a consumer and you have to make your most informed decision. But if I feel like you're doing something that's going to harm you, I'm going to be honest about it.
Yeah. One of our doctors that I interviewed had said that she will give the best evidence, the best advice, but that ultimately if a patient decides to do something different, that the decision is the right decision for that patient.
Exactly. I mean, they are, they have the freedom to make that decision.
Yeah, that must be very tough when you've got evidence leaning towards one thing.
Yeah.
But you still will be an ally in their
Yeah, it's a challenge. And there are circumstances where someone may want to do something that could be potentially harmful. And at that point, we have to draw lines.
Yeah, I bet you that is a really difficult thing for you to face. Tell me what you meant about the challenges of survivorship with people living longer. What are you facing? What are patients facing?
The median survival of virtually all cancers is better than it was in the past. So a lot of cancers that were once uniformly fatal are now cancers that people can live with for extended periods of time, where once maybe the average survival was a year and a half, now maybe it's 4 to 5 years. So even if it's not a curative treatment, you have life with cancer that requires ongoing treatment. And those are the folks that tend to live with the most stress because they know it may never go away. Whereas folks who have no evidence of disease and are potentially cured, their risk is lower. But across the board, people are living longer than ever with cancer. There are more survivors in 2025 than there have ever been. And 5 years from now, that number will be significantly larger.
Wow, isn't that crazy? 5 years, so what a difference that can make.
It's wonderful and a little bit daunting. It's why there's a shortage of providers. There's so much more work to do and not necessarily more folks to do it.
Right. So do you find that your number of patients are increasing? I mean, what's the world of cancer like right now as an oncologist?
We have more people to take care of for longer periods of time. We engage nurse practitioners and physician's assistants to help us because we do need people to do surveillance and to look after their needs that are related to cancer. So it's just a lot more care being delivered for a longer period of time.
And isn't some of the reason because of the science of the things that we could take advantage of right now, like multi-cancer early detection, things like that? Why don't you tell us a little bit about that?
Just on the treatment side, we have better treatments than we ever have. More specific, more focused treatments, less toxicity, and better survivals. Now we have early detection, which is going to be big for us with multi-cancer early detection. The sooner we catch a cancer, the greater the probability of cure. And then we're going to be looking at preventive medicine. There are vaccines to prevent things like cervical cancer, and there may be more vaccines both for treatment and for prevention. So the cancer burden is not going away, but our ability to manage it is getting better.
Yeah. So as an oncologist, does the multi-cancer early detection, so if somebody can find out earlier that they are at risk or that, genetically this runs in their family, et cetera, how does that increase your workload? Like from the past?
That hasn't changed things a lot for me yet.
Okay.
I actually participated in a clinical trial for one of those.
What do you mean? How did you participate?
Ochsner had a clinical trial and I signed up for it, and they tested me, and I filled out a questionnaire and I was negative. So
was it an easy test?
It was just a simple blood test.
A blood test.
So what that is if a positive test comes out, then we aggressively evaluate. So that would not take place so much in my clinic, but if a cancer were found, that person would come to us for treatment. That's not a big part of my practice today, but in 5 years it may be.
Yeah. So for instance, if somebody went and got one of these blood tests and the test showed that they were at risk, or what's the time we're not
actually it would give a positive signal of a certain type of cancer. And that would precipitate an evaluation to look for it with scans and blood tests and other things like that.
What if those scans didn't reveal much?
Then we watch.
Then you just keep an eye on somebody. Mm-hmm. Okay. So then that person lives with Scanxiety.
Very much. But the false positive rate is only like 1%. So if you get a positive test, there's a really good chance you have cancer. Those tests are getting better. And I think the refined process will give us a better way of screening. Instead of just going for a mammogram and a pap smear or a PSA, you're going to have a blood test that's going to be even more sensitive and specific.
Okay, so this is going to make me sound like I don't know what I'm talking about, but do most of us have cancer cells living in us that just...
Probably not.
No, okay. I had heard somebody say that once. So for the people who do through these tests, in a way, if you flip the script, instead of living with the Scanxiety or the anxiety of knowing, wow, I've got this, it really is more empowering, right? Because you could catch these things so
absolutely,
right?
I would much rather know when I have a very small amount of cancer than wait until it's clinically significant. And that's why I can't emphasize enough the importance of screening. Whether it's your mammogram or your colonoscopy or any of the, depending upon what your age and gender. You want to look for these things because we save lives. The screening tests were approved because there's a survival advantage.
Right. So that is empowering. So that should make people take a breath that test is available.
Oh, absolutely.
What's the difference between somebody not knowing and waiting too late until it's like stage 3? Like what is so important about knowing early and getting this taken care of at an early stage?
So the earlier the stage, that means the less cancer you're dealing with. And as cancers grow and spread, they become more resistant to treatments. So you would rather, the military analogy I use is you'd rather take on a platoon than a whole division.
Oh, wow.
And so the advantages of screening and early detection are monumental in survival.
Yes, absolutely. It's so funny how many times I hear ladies, I don't want to say funny, but like yesterday, at least 3 ladies said, the 1 year I missed my mammogram, and then a year later, and it's like, why is that coincidence? Why the 1 year that they miss their mammogram, they find, I'm in the shower and I found a lump. But everyone I talk to does say that the early, the ones that find out early, their whole journey is so much easier.
It's much better. And in fact, you can look at the statistics of survival versus stage, and the earlier the stage, the longer the survival. Once a solid tumor is stage 4, widely metastatic, the probability of cure is small, but it's not zero. You can still have long-term disease control there.
Yes, yes, because when I started this program 11 years ago, if somebody said they had metastatic cancer, you would just almost be saying goodbye in your head.
Right.
And now you find that and you see these ladies living great, beautiful, productive lives. They just have to stay on.
It's very true. I mean, breast cancer is an area where women live for years with sequences of therapies and have good quality of life along the way.
Yeah, wow. I wanted to talk about what are some of the ways we mentioned earlier, finding a, good support system and, prayer and all that. But have you found when somebody is really facing anxiety that they can get it under control and live a very happy, joyful life? Like, what's the best advice you can give somebody to just say, you need to keep living?
Yeah, I mean, and I think we do use language such as that, keep living. There's the movie Beaches.
Oh, yeah.
There's a scene where, you're not dead, keep living, and it's just Bette Midler, the way it comes out of her mouth is a little funnier, but she's basically saying, you're still here, so why don't you act like it? And she was a little harsh about it, but that sort of advice handled in a diplomatic fashion by a loving person, a concerned person, is very meaningful.
Yeah. So it's the difference between how would I be living right now if I wasn't diagnosed with cancer? Because if you say, how will I be living now that I know I have cancer, then you might just curl up on the couch.
Yeah. And then some people, when they find out, if they feel like their time's limited, they appreciate the time a little more and their lives become very purposeful.
Yes.
And every individual has their own approach to it.
Yeah.
And I think engaging someone in a support group or with counseling is super important, because that counselor is going to find out what's best for you.
Yeah. Now, one of the big stressors are finances associated with medical bills and just losing your livelihood. You don't work as much, or maybe, as we hear all the time, an employer actually fires somebody because they have been diagnosed. The husband has to take on the role as caregiver, meaning he can't work as much. Maybe the insurance is not what they need. What kind of things do you see and hear?
So a major part of the anxiety of having cancer is the financial risk. We're the only country in the world that has medical bankruptcies because we don't have a very good healthcare system when it comes to managing expenses. So people sometimes make clinical decisions based upon cost. I've had people say, I'd rather not take a treatment that adds 6 months to my life if it's going to bankrupt my family.
Yes.
It's very difficult because those are a meaningful 6 months. And I don't have a good answer to that question other than the advocacy that we continue to do to try to help our country get a more, favorable healthcare system.
What can we all do to raise our voices about that?
I think get informed. I'm a very big advocate of universal healthcare. We're the only first world country on the planet that doesn't have this, where healthcare is a right, just like going to school is. It works. It can be done. There's different ways of doing it, and getting informed and voting for people who are going to try to get everybody healthcare is what I would recommend.
Yesterday, I heard a story. This is just based on a financial discussion that we're having right now. One of the women got diagnosed very young and immediately got a phone call from a fertility specialist and said, hey, I'm Dr. So-and-so, and let's talk about freezing your eggs. And she's still reeling with the information of, oh my gosh, wait, I just got diagnosed with cancer. Now we're talking about, preserving my eggs. She wasn't even married. Mm-hmm. And it doesn't even haven't found a significant other, but the thought process was, wait, what if someday I am? And, so she had already had to start thinking about her future as a mom or the ability. And so she did start that process, and she said she froze several eggs and, constant, feedback that, oh, that one didn't take. And eventually, out of all the eggs, I guess, that she harvested, one of them did take, and she now has a healthy 3-year-old son. Now, that's the good news, right? But the bad news, the bad side of that was that out of pocket, it cost her $160,000.
Goodness.
And she said, she goes, it's well worth the money, but if you don't have that money,
Right.
I mean, where are you going to come up with $160,000? So I just wanted to ask you, this is a little off topic, but are you familiar with the Fertility Preservation Act?
Absolutely.
Is that just a Louisiana thing, or?
Well, Louisiana has passed legislation, but I think it's something that is going to spread across the country, and it really should be something that's covered by health plans. Health plans that exist to make a profit want to cover as little as possible, and that is an expensive form of therapy, but it's very important.
So is that actual past legislation here in Louisiana?
I think Louisiana has a bill. I'm not sure the exact status of the law right now. I do some advocacy work, and it's been a big part of our one of the things we've been fighting for.
Yeah.
But it's super important.
Yes.
For young men and young women to do fertility preservation.
Oh, can you even imagine how much less of a burden getting diagnosed with cancer is at if you're still childbearing, to have that resource?
Absolutely.
Talk about releasing some of the anxiety.
Yeah.
Geez. Well, I wanted to ask about just, overall, tell me, you recently spoke with a group of women at your hospital, Toro Infirmary, and what kind of interesting questions did you get from the ladies about this topic?
A lot of them had specific questions about their type of cancer and how things have changed over the years. And triple negative breast cancer, well, I know someone who died 10 years ago, but now I'm in remission, and what happened, and trying to explain how therapy has advanced and how much better people with certain diagnoses are doing now as opposed to in the past. And I always try to make that a theme of whenever I speak to patients, we're getting better at this. We seem to, we still lose a lot of people to cancer, but cancer-related mortality is down, and we are getting better, and there is hope that it'll get even better. So I'm pretty optimistic about it. I don't think I could keep doing it if I didn't have the optimism.
Right. Do you think the number one advice is to trust your team?
Yeah, trust your team. Do your research, go to credible sources, talk to a lot of people, get that second opinion. And I think look at people's credentials. I mean, I'm a board certified medical oncologist. To maintain that, I have to do continuing education. I practice evidence-based medicine, and I have to stay up to speed, or else I would not be able to do my job, and check on people's credentials.
Yeah, and I think also, besides you as an individual, you have a team that you surround yourself with, right? It's
a group of doctors. Cancer therapy is multidisciplinary between surgeons and medical oncologists, radiation, pathology. It's not just one person. It's not like when you break it wrong, an orthopedic doctor comes in and fixes it.
Yeah.
It's multidisciplinary. I think we are holistic in the sense that we are not only treating a cancer, but treating a person who's living with a very traumatic illness, and we have to take care of all those needs.
Like I said, I've met ladies who just have horrific experiences with the team assigned to them, but the majority of the women that we work with talk about their team as their family.
Yeah.
And they actually tear up as they describe the nurses, the doctors, the people.
Oh yeah, it is a family relationship. And that's why I think our team very much pulls together. And if someone passes away, it affects us all. And I know Unite has a similar situation. It is like losing a family member, and we celebrate the victories as a family as well.
Yeah, and as you know, at every Unite, we always have the pictures of those ladies who have passed away, just because it's like, their fight was not in vain. And we remember them, first of all, as the beautiful women that we came to know, but also to say we can do better, and we are doing better. And like I said, in 11 years, I've seen progress, and I'm just running this program, I'm sure you can talk about some amazing things that are happening that should make us more hopeful.
Yeah, I think that a deeper understanding of the genetics of cancer, early detection, the pharmaceutical industry being able to develop drugs that specifically target genetic abnormalities. Chemotherapy is kind of a broadly toxic, whereas a more targeted therapy only goes after the bad cells. So better outcome in terms of controlling the disease and less side effects for patients. And I have patients who come in and go, I have cancer, but I feel fine. And look, I still have my hair.
Oh, wait, so with targeted therapy can eliminate some of those horrible things that people have gone through?
Correct. Yeah, there's generally less toxicity. And all medicines have some side effects, but in general, the quality of life on therapy is better.
That's exciting.
Yeah,
Oh,
that's really good because a lot of the early treatments are, as you know, very difficult.
yes. Oh my gosh, what women and men go through, and children. Is there anything that we didn't cover today that you wanted to mention as far as?
I think just whether whether you're perfectly healthy or battling a disease, inform yourself as well as you can. Get good information. And become well informed and look for credentials. I mean, when I need health care myself, I go to a primary care physician. I do not decide what lipid lowering drug to go on. I talk to an expert and trust them and do my own research, but I do choose doctors to guide me and don't think I know more than that.
Yes. And in our group, I mean, the ladies are constantly saying, hey, who do you recommend? And, finding people who have had positive experiences.
Yeah, I think that's the most important.
Yes. So I'm sure that you often come upon people who are not managing stress at all, like where they're maybe in denial. What do you do with people?
Right. So there's a couple of things. Well, denial is obviously something that's very dangerous. And usually beneath the denial is someone who does understand they're sick, but they're just not managing it. And one of the things that people sometimes do is they adopt the rugged individualist approach. I'm not worried about this. It's all good. I can handle it. And all too often when they don't share or they don't take a healthy approach, they might turn to something that's addictive. And all too often things like alcohol and drugs can be used as a means of managing this, and it's just not a healthy way of managing stress. And I worry a lot about that because it can be a very slippery slope.
Yeah, in our program, we have women who, one of the reasons they don't want to sign up is that they say they don't want to necessarily pull out the weeds, like to actually visit some of the trauma.
Right.
They'd rather, I don't want to say live in denial, but almost pretend like it doesn't exist. And so with some gentle coaxing and stuff, when they come into the program, we really help them evaluate their true feelings. Sometimes that's hard for them to get to that point where they're being real with themselves. But once they realize, wow, that stuff is like buried inside of me. And it's better to just sort of address it and then do something with it healthy.
Correct.
Rather than keep it suppressed, like you said, and have it turn into even worse health, right?
Correct.
If you're bearing that health, if you're bearing that trauma, it can have secondary health problems probably.
Exactly. And then, face it in a healthy manner with someone who can help you along the way. And I always stress, go to someone with training who knows how to do this, or be part of an organization that does it in a healthy manner. But don't ever try to just go it alone.
Yeah.
A rugged individualist is usually not going to be as strong as they think they are in the end. And that's where we worry about unhealthy behaviors.
May I ask, is that generally speaking a man, or does that go both ways?
I think men are a little more inclined to that. I mean, my generation grew up watching John Wayne movies and thinking that's what we're supposed to be like. And that works great in the movies, but it doesn't always work in real life.
Yeah, I am telling you without question that when we do SCART, and the husbands or significant others come alongside the ladies, and we say, hey, you want to paint and do you want to share? Every single man who has ever come, who gets up to talk, cries every single time. And what they share is almost more heart-wrenching than some of the ladies, because you can see that this may be the first time they've ever been able to articulate what they've gone through.
It may have been buried for a long time. I think, My generation was not given permission to do that. We were told to just tough it out. Once you're given permission to share, it makes it easier, and you might be opening the floodgates.
Yeah, and social media, I know, can be an interesting landscape, but I think that truly there is power in sharing stories, men and women. Another side of anxiety is not just the patient, but it's the loved one. I mean, whether they're in the room at the time that you're trying to deliver all this information, or they're having to walk alongside their loved one through all the treatments and the, surgeries, and maybe the loved one becomes depressed or is not their same self anymore. Do you find that your role with the patient extends to the family members?
Yeah, absolutely. And I think I always say cancer doesn't just affect one person, it affects whole families and groups of people, friends and acquaintances. And it can be emotionally exhausting for a loved one who's trying to be strong for their person who's fighting cancer. They have needs too, and we need to engage them as well, because they are just as likely to be harboring that stress, fear, as our patient is.
Does the hospital have mechanisms to help the entire unit, the family, as well as the patient?
Probably not as much as we should. I think some support groups are open to whole families. I think certainly at Unite, we have a mechanism for getting husbands involved.
Yes.
And I think that's very important.
Yeah. I have heard so many ladies who talk about that the minute that they were diagnosed with cancer, their husband leaves. And I think it's because they don't know how to handle. I mean, instead of addressing the anxiety, they bail on it.
I've seen that in my own practice. It's devastating, kind of amazingly cowardly on the part of a person to do that, but it's just devastating to the patient as well.
Yeah, and that's a whole other kind of anxiety, because the women who are, especially if you're a mother, I mean, I can't tell you how many stories involve the men leave, and then they leave the woman by themselves. And then now the woman is the sole provider financially. They're raising the children by themselves. They're dealing with the cancer diagnosis.
It's just trauma piled upon trauma, and it's devastating to people and their families.
Yeah. So in that example, that is truly one of the reasons that I encourage people to get involved with programs like Unite. I don't know who's listening from across the world on this, but if you can find survivorship programs, it really is important, because you're going to find women. If ours is pretty women-centered, but you will find a very helpful community where you don't have to be facing this alone.
Right.
And you can find a way out of the pain.
Yes.
Dr. Ellis, thank you so much for sitting down with me today to have this very important conversation. I would really love to ask the audience to share some of their successful ways of coping. If there's something you do that helps you, please write to us and share some of those coping tricks that you have that help you stay calm, or questions you might have that we could follow up with Dr. Ellis to answer. Because relapse anxiety and scanxiety are experiences that so many survivors share. It can feel overwhelming, but as we've heard today, these are strategies. There are strategies and supports that can help make a real difference. Most importantly, you're not alone in this. So Dr. Ellis, thank you so much for helping us shine a light on this very important topic, and for reminding us of the power of compassionate listening.
Thank you.
Thank you. Thank you so much for tuning in today and listening to the story. Please do us a favor, click the subscribe button and consider a donation. Did you know just for $3 a month, you will be supporting such a huge project where we can get the stories and the voices of these amazing survivors out to the world so that others can find hope, information, and inspiration. Your support means the world to us, and also the fact that you're here today means everything to us. Have a beautiful day.